Hi guys. Okay, so Monique, this is for you. Hi. Okay, so how to avoid being burnt out. This is something that I think every individual has to find their own way not to be burnt out. But there are some tips that I can give you because everyone has a different routine. I really think it depends on your routine and what you prioritize. As CNAs, I'm talking from a CNA perspective. When you first come on your shift, it does seem a bit overwhelming. You're giving information, and then depending on what shift you have, like in the morning time, from what I find working in the hospital, the morning is not so when CNAs come on the scene. That's what I'm talking about. Patients are still sleeping. There's little activity on the call light at 6 o'clock in the morning, for example. You have some people that want to go to the bathroom and everything, but it's not a lot. Now, coming from the perspective of night shift, when you get on at about 6 o'clock, it's different because people have eaten their dinner or they're getting their dinner, depending if it's on the weekend. They usually give out trays later, but we usually come during dinner time. Some people have to be fed because they were sleeping, and we have to feed them, and then people have to go to the bathroom. There's a lot of activity going on. You have family members still there. You have doctors coming in and out. I mean, it's really crowded. It's a lot of activity, and everyone wants something. So it depends on how you shuffle your tasks. When we first come on, for example, we get the report and then we do the vital signs. What I can tell you is, before you go into the room, take a look at your report, your sheet where you have all your patient information. Start organizing your information based on what the other aide told you, what they need, and things like that, what the things that they didn't get done. You start making your task sheet, or whatever, wherever you do what you do, and then you start prioritizing. When we first come on, we do that, and then, well, I do that, and then I would start my vitals. And while I'm in that room, I make sure I do everything, because I don't want to backpedal and go back into their room because I neglected to do something. And another thing that I do is I get a cart and I start filling it up with juice and ginger ale and sandwiches and water and things like that. Because when you come on night shift, I'm talking from the perspective of the night shift as well, and working in the hospital. Night shift, morning, the morning time, they probably didn't have time to pass out fresh water, and so that you won't be overwhelmed, and so that the call lights won't be ringing off the hook because someone wants water, this one wants juice, that one wants a ginger ale. And you would think that because they just got dinner, they wouldn't need anything to eat, but that's not true. They want a snack, they want something else to munch on. So I would get my cart, fill it up and everything, and while I'm in the room, I take their vitals. I make sure there's not like excess linen. I make sure their garbages and everything are, not overflowing. And I ask if they would like a snack, and I automatically, I don't care what they have in their cup, I change it out and I fill it unless it's already filled and there's ice and they're good. If it's halfway, I'm throwing it out and I'm giving them a fresh cup of water, because within a half an hour they're going to be ringing on that call light. From experience, I know I need more water. So I make sure they have their pitcher filled with ice water and another cup of water. So bam, right then and there, they're not going to harass the nurse for water, and they're not going to harass us for water. Get the little things covered first. That's what helps with you not being so overwhelmed and burnt out. And while you're in the room, make sure you cluster all of your activity. Do everything for those patients while you're already in the room, so that you won't have to come back for an hour or two. And at night, we do hourly rounding, and I think from 10 o'clock on, it's from 2 hours, and from 6 o'clock to 10 o'clock, it's every hour. But because at 6 o'clock we were there already, the next one who rounds will be the nurse going in there. So we're covered for 2 hours. So cluster all of your activity. And also, this is, I think, is the number one thing before clustering. First, you have to have a mentality and an understanding that you are only one person. You are not the CNA superhero of your shift. Once you get that in your mind, then a lot of pressure will be relieved from you. You have to understand you're one person. And if your phone is ringing off the hook and you hear lights, but you're in the room with the patient already, you just keep reminding yourself you are not the only employee. You're only one person, and you're doing what you can to make this patient comfortable and doing whatever it is that you're doing, toileting them, or you're changing their bed or whatever. Do what you have to do for that patient in that room, and when you're done, then you go to the next thing. And another thing, when, I don't know the procedures of every hospital, but in my hospital, for example, we're given phones. If I'm already in the room with that patient and I have gloves on and I'm doing something like changing them or something like that, or something where my hands are dirty, I am not going to pick up that phone. And if I'm in the process of doing something for the patient and it's not something like vital signs, I can pick up my phone for that. But other things that I need to stay in that room for a while, I will not pick up my phone. Because what I have learned is, if you pick up that phone, now you're responsible for whatever that person on the other end is going to ask you to do. And in their mind, they want you to do it expeditiously. So what I do is just don't pick up the phone at all, because if they know that I am unavailable, they will have to call somebody else to do it. So that relieves me of that responsibility as well. And this is just my system, because I understand I can't do it all. I'm not going to be running here, there, and everywhere. I'm not the only employee. There are other aides. There are other nurses. There's the nurse for that patient as well. So we are all a team, and we can all get it done. Now, if you have a mentality that we're not a team and I am the sole person responsible for this and that over there, then you're going to be burnt out really quick, and you're going to be frustrated, and you're going to hate your job. So number one, understand you are not the only person working there. Don't try to be a superhero. Number two, cluster your activities. Do everything you need to do for that person. And also, you have to anticipate certain things. Like, make sure that before you start anything, start doing checks. Make sure your linen cart is full, because if something happens and you need towels immediately, now your linen cart is not full because the aide before you did not fill it up. So now you have to take that linen cart all the way down the hall, spend a minute or two filling it up, and then bring it right back down the hall. And I mean, it's just a lot of extra. So just make sure you have all of your supplies. Go in the medicine room or the supply room and start getting things in the basket, things that you know you're going to need, like soap and continent pads, extra socks, toothpaste, a toothbrush, things like that. Just fill it up, leads, all of that. Fill it up in the basket, put it inside your linen cart area, make a little space for it, briefs and all of that. And so that you won't have to keep running back and forth getting supplies. Make sure you have the things that you know that you use on a regular. Get the skin barrier cream, all of that. So that when it's needed, you can just go right there, grab it, and you're not wasting any time. So understand you're one person, cluster your work, and anticipate things that can possibly happen. Like the fresh water, or have a cart, just push it along with you, and do what you need to do for that patient in that room. Make sure everything is done, so that next time you have to go in the room is if, for instance, they ring, if they're not a cell or a walkie-talkie, if they ring and they have to go to the bathroom, you take them to the bathroom or whatever. And that's it, or round on them when it's time for you to round. But you are free to know that you don't have to go back in that patient's room to pick up linen and to empty the garbage and to make sure there's nothing in the bedside commode, all of that, because you did all of that in the room already. So that's just task related information. Now you can also get burnt out by your other employees. They can burn you out. So another thing that you have to learn how to say is, I'm busy right now, because you can't help everybody in the world. You have your own work to do as well. Now, if someone needs a pull up or something like that, that's just going to take a couple of minutes. But if someone's just coming on your shift, for example, and they need help with a bath, you have your own work to do. That CNA needs to go find their nurse and ask for help, because that right there is going to pull you back on your time and what you need to do for your group of patients that you have. That's why bed baths and all of that, if it's not like if a person didn't do a blowout or something like that, if it's just a bed bath, that can wait. That's where prioritizing comes in. You don't need to immediately give anybody a bed bath if you didn't even do your vital signs yet. You see? So you have to learn how to prioritize. Also, with not being burnt out is when other employees try to ask you to do certain things, like say a CNA is like really busy because they don't know how to prioritize, and they see you walking down the hall and you're on your way to do something for your patient. Oh, can you do this and that for me? Tell them no. What I look like? No. Tell them no, you're busy right now. We all know everyone is busy, because you have some CNAs that do that. They like to order other people around and have people do their work for them. Oh, can you go in this room over here and fix this person's leads because I have to go over here and give this person water? No, you don't. Go over there and fix that person's leads. Then you turn around and you go get that other person that needs water some water. Leads are more important than water, because if something happens and they don't see what's going on with their heart and they die, it's your fault. It's your fault. Some things are just more important than other things. So things like that. And also with nurses, sometimes you have to tell them, look, I'm busy. Sometimes if they see, because you have some certain nurses, I should make a video on different type of employees, CNAs and nurses. You'll have some of them, now this is still the morning shift crew, they'll just start giving you things to do. Now, because as CNAs, when we first come on our shift, especially at nighttime, it's really hectic. You really do hit the floor running. And I don't know what's in the nurse's head at that time, but I don't think they understand. That's why I think, we all should come together and have some type of meeting and get an understanding of one another's day, so that we can know, what to do and what not to do, and how to have consideration for other people. I think that would be good, because if we don't have an understanding of roles and responsibilities and a particular point in someone's day, then that opens the door wide for people to take advantage of other people and expect them to do unrealistic things, or unreasonable things and unfair things, and all of that. So what was I saying before I started rambling? Oh yeah, so you have to learn how to also say no. If you're busy, you're busy. When you're finished doing everything that you are supposed to be doing, because remember, as a CNA, you're working with up to 5 nurses, sometimes 6, depending on how the hall is split. So you're being pulled by 5 different nurses. So you cannot be the superhero of everybody. So you can't just keep running, helping your, fellow CNA do this and do that, and then your own work is not complete. And then you have nurses from other hallways who wants you to do something because they know that you're a good aide, and the aide that they have right now sucks. But that's not your point. That's not your fault. just to be on their good side or whatever, or, just to keep the peace. Some aides go and do what they ask, but then their own work is suffering. And then when they get so overwhelmed and so busy, they're sitting there wondering, what in the world happened, and how come, I have so much to do, and how come I'm so overwhelmed and frustrated? Because that magic word no, or I'm busy right now, has not been expressed. So you can't be afraid to say I am busy. So I think that's about it. You just have to learn how to prioritize. Make sure you cluster all of your activities and begin to anticipate what may happen, and go from there. Also, what I usually do is start with those who are most likely to need more help. I'll start in their rooms first. So all the self people will be last. I'm not going to skip rooms because then I'll forget, but I'll start, where there's a total patient. Maybe that patient didn't eat yet. Maybe they were sleeping, or maybe the aide just didn't have time to feed them. I'm going to go to that person first. And, bring my little vital sign machine in the room. And if they haven't been fed yet, take their vital signs, then I'll feed them, and then do whatever I have to do in the room, and then go about my business to the next person until, my phone rings and something more important comes up where I have to stop my vital signs and then go. And then that's another thing. You also have aides who just have a one-track mind. I just have to get my vital signs done, and then I'll do everything else. Do everything at one time. Vital signs are important, but having a one-track mind, I can't answer that call light over there because I have to get my vital signs. No, put the machine away. If the nurse needs a particular vital sign done and you're helping a patient, the nurse is fully capable of taking someone's vital signs. The machine is not stuck to your hip. It's not yours. You don't own it. Nurses can take vital signs too if they really need it in that moment that you can't get it. Okay, so just take a breather when you're working, because when I'm working, it's just like nonchalant. And people are looking at me like, how come she just looks so calm and normal? Because once you start having experience and you're in your own flow, you don't let those things overwhelm you. You know that you have 12 hours to do everything that you have to do. Our job is something that whatever you have to do for that patient, you can do it within those 12 hours. I am speaking from a CNA perspective, not a nursing perspective. Their task and their responsibilities and what they have to do is totally different. So, I'll be moving. I'm in a car line, y'all. I'm picking up my kids. And these car lines are ridiculous. First day of school. And I'm already done with this foolishness. So yeah, I hope this helps someone. If you are burnt out, 9 times out of 10, it is something that you can change, and it sometimes is things that we do that is not necessary, that burns us out the most. Certain things can just wait. Do what you have to do that's more important first. And also, take your breaks. Take your breaks, people. Take your break. Take your 15-minute break. Take your half an hour break. Take your second 15-minute break if that's what you're allowed. Take your breaks. That's going to help a lot. And when you take your break, whatever the procedure is, give someone your phone, let someone know, have somebody cover for you. But if you didn't give anybody your phone, but you just told someone, listen, I'm going on break, or you told your supervisor, I'm going on break, turn your phone volume down so it won't ring and disturb you on your break, or just leave it, at the desk or something like that, because You don't need to be answering your phone or hearing that ring, ring, ring on your break. You don't need that. Take a time, relax, you know, read, laugh at a joke on social media or whatever. Just take your break, people, because you're going to need it. All right. So, yeah, I think that's about it. So, you guys have a wonderful day, and I will talk to you later. If you have any video suggestions or questions or anything like that, you know where to put them in the comment section, and I will do my best to answer them in a timely fashion. Bye, guys.